Are you thinking about receiving the COVID-19 booster? Well, here today to tell us more about these boosters is infection control practitioner at GBMC, Molly Hyde. All right, hey there again, Molly. So
Hi.
can you outline some of the differences among the vaccines for us?
Yes, so the boosters are authorized for all three of the different vaccines, but there are some differences in terms of eligibility and also timing of the boosters. So all of that is going to depend on the initial vaccine that you received. So if you received the Pfizer or the Moderna vaccine, then you're eligible for a booster if you fall into one of three categories. And those categories are people age 65 and older, people age 18 and older with underlying conditions that put them at high risk for severe COVID, or people 18 and older who have frequent occupational exposure to COVID or live in a situation where they're frequently exposed. They are all eligible for a booster, and they can get that booster 6 months after their second shot. Now, boosters are authorized for everyone who received the Johnson & Johnson vaccine, and people can get their booster 2 months after their Johnson & Johnson shot. So it is a little bit different with the different vaccines.
And so can you explain again, I know a lot of people have gotten them, a lot of people still maybe on the fence. Can you explain again about the safety of the boosters and how they work?
Yes, absolutely. So boosters are safe. So in order for boosters to be authorized by the FDA, they had to go through clinical trials, and then those clinical trial data had to be presented to the FDA where they ruled on safety and efficacy. So they would not have authorized them if they had not been determined to be safe and effective. Now, the way that boosters work is pretty much exactly as the name implies. So they give a boost to your immune response after your immune response wanes over a period of time. So what happens is when you get your booster shot, it reactivates your immune system to give you better overall protection against COVID.
Okay, that makes so much sense. I hope that our viewers at home have a better understanding too. Now let's talk about mixing and matching the COVID-19 vaccines. Can you explain that?
Yeah, absolutely. I think this is where people got a little bit confused about when to get the booster and what booster to get. So FDA has allowed for you to mix and match vaccines. So you don't necessarily have to get the same booster shot as the initial vaccine that you received. You can get a different one. That is possible. Now, there really is no recommendation at this point about which is the best. So when the study came out about mixing and matching, all they looked at was, is it safe and is it effective? But they didn't compare and contrast the different vaccine booster combinations. So at this point, it's generally up to you and your doctor to decide which combination is best for you.
Okay, and is it still possible to be fully vaccinated without getting that booster?
Yes. So CDC has not yet changed the definition of fully vaccinated. So you are still fully vaccinated either 2 weeks after your second dose of Moderna or Pfizer, or 2 weeks after your single dose of Johnson & Johnson. Now, they will continue to review the data and see how well immunity holds up over the long term in people who got boosters compared to people who didn't, and they may or may not change that recommendation.
All right, great information. Molly, thank you so much for joining us. We appreciate you.